All right. So, welcome to the Wednesday morning FFL Medicare podcast. I'm Eric Amati, your host. I got Brad Allen from, is it FFL Emerald City?
Correct.
Okay. Yeah. But you're no longer in the Emerald City, right? You're in Phoenix.
No, I'm in Surprise, Arizona on Dynamite Boulevard. I'm not making this up.
That's great. Surprise, Arizona, Dynamite Boulevard.
Yep.
That's awesome.
Yep.
So, so tell us. I guess I had the chance to meet you. I still remember it. We were on a panel together.
That's right.
And at the Dallas convention that in 2020.
Yeah.
We did 7 conventions, right?
Yes.
Was that right? Yeah. 7 conventions. No, it's 2021. Pardon me. 7 conventions in 7 cities because of coronavirus restrictions. And you and I were on a panel together. Right. And I still remember your answer. They were asking what books would you say have impacted you the most? And you were like, yeah, I don't read books. I go to where I'm too busy writing business. And you were, I think, number 2 in the company that year. And so I was asking you just some of your strategy. And I just thought your whole approach and the way that you do things, I think all of our listeners can super benefit from it. I know Medicare has been a big part of what you're doing. So why don't you start and just tell us kind of your history, how you got into the business and kind of where you are now.
You bet. So actually, July 15th, so in 2 days, this Friday will be the 4-year mark since I've ever sold anything. I mean, I didn't even sell a car. I just traded them in because I had like phobia about selling. I was licensed for a year, never made a sale at practice companies. And then I came here and it's like, what are leads? Right. So it's like, right. I remember asking, how many can I buy? And they're like, what? I mean, all of them. I said, yeah, then I will do that. And I came across Medicare leads. And, the thing with Medicare, we have 5 things plus building a team that we can do with our license. You've got term, universal, whole life, index annuities, Medicare, right? So when I started, it was always 5. And I learned everything I learned about doing Medicare from Skylar Smith. The guy was he was just the oracle. Everything that I ever wanted to know. I was in a home over and over and over. And I sold a ton of supplements, right? I think it was like number 3 or 4 one year. And I would just always go to Skylar. But so Medicare appointments are like the easiest to set. I've had people come off vacation to take an appointment with me.
Wow.
I mean, yeah. And so when I'm sitting in a Medicare appointment, it's just like any other, right? I walk in, I introduce myself. I guide and direct us to a place where we're going to conduct business. I hand out my business card and I say, this is what I do, basically health and wealth. I do final expense. I do straight up insurance. I do mortgage protection. I do retirement plans. So I can protect and grow your assets for you. But today, what we're here to talk about today is Medicare. And I cover the gaps in Medicare. So I kind of let people know when I first sit down with them that I'm not just a one-trick pony. And here's why. So when we were in Dallas, Eric, and we were sitting on that stage, that was in 2021, but it was for the 2020 year, the production, right? And I ended up being number 2 in all of FFL with 1,100 families helped. And half of those came from annuities, right? And half of my annuities came from Medicare appointments.
I remember you telling me that. Yeah.
Right. So people are like, oh, you don't make any money with Medicare. It's a lot of work, blah, blah, blah. It's like absolutely not true. As a matter of fact, just yesterday here in Maricopa County, where I live now, I locked down the county for Medicare leads, the T65 leads from corporate. Yeah, they're 62. Do you want them? It's like, yeah, I'll take them all. And I've always been that way. It's like, how many leads can I get? I will take them all. Right. I can have as long as you're working them, there's always an ROI on this stuff. So I guess that's the first thing I would like to just dispel the myth that there's really a lot of work and not much upside financial gain, because that is absolutely not true. You find a lot of referrals. I have found a lot of referrals. And I've written a lot of final expense as a result, because here's the deal. When people trust you with their healthcare, they trust you in a lot of other ways. And if you do a good job, people that are 65 and over, they love to share their good or bad stories. So make it a good one, right? If you're going to do a really good job protecting somebody's healthcare, they're going to tell their friends. I mean, they're retired. That's what they do. Talk, right? And
Right.
so what are they talking about? This guy, Brad, he was so charming and handsome, and I mean, just right on point. He helped me. No, they probably don't say that, but I mean, I've got a lot of referrals. My point is, I've got a lot of referrals, and I've got a lot of follow-on business. But you want to make sure you run the appointment you're there to run. Don't reach past the reason that you're there. That'll get you in trouble. Medicare is highly regulated. So I've done Part C, the Advantage plans. I've been AHIP certified, a couple of years. Right now, I'm focusing on supplements. And there's a reason for that, because I'm running a lot of business, right? I'm growing a team. I'm running a lot of business. And the sales tail behind the Medicare Advantage plans can be a little bit more. Right. And I just, frankly, I would hand those appointments off to somebody else on my team. I'm going to focus on supplements.
We'll talk about that for a minute. So when you say, you're talking about fulfillment after the sale, right? So if I sit down with somebody and they want to enroll in a Medicare Advantage and I help them with that, what are the responsibilities I have after that sale that I typically wouldn't have with a Medicare supplement?
So with a supplement, you just need your life and health license. That's it. So it's basically, you go anywhere you want. There's no network. You know what your costs are up front. It's going to go up about 4 to 6% per year on average, right? But it covers the most important gaps in Medicare, the Part A and the Part A deductible, which is this year like $1,556, which is not nothing. And then the bigger gap, the 20% that Medicare doesn't pay in Part B. So like the doctor, right? They'll cover 80, you're on the hook for 20. And 20% of what? You don't know.
It's unlimited, right?
Right. You just don't know. And with Medicare Part C, it's typically, in my experience, people that are looking for something free. You got Joe Namath on the TV. Hey, I'm going to bring you a cheese sandwich every Friday night. Free. So you're sitting in front of people that are looking for a lot of free stuff. And there's nothing wrong with that. I'm just saying that in my experience, there's a lot of follow-on questions like, is this free? Is that free? So my phone's always blowing up. It's like, am I getting discounted vitamins at the Walgreens? It's like, are you kidding me?
Is this part of my plan, or is that not part of my plan? Or why is it? Can I go to this doctor, that doctor?
Absolutely. And so after the sale, I get a lot of questions because they get this book, from whoever, Cigna, Humana, United Healthcare, and it's like 2 inches thick. And with the supplement, it's like maybe a 1/4 inch. You have healthcare, right? It's covering the gaps in Medicare. Just show them this temporary card. So there's that. And then to do the AHIP, I was taking 8 tests. So I took the AHIP, which is not free. And then every carrier, and I did 3 with every carrier, it's both the Advantage plus the drug plan. Right. And so, I had all of these ongoing requirements for maintaining my cert, as opposed to just keeping my license active every time I'm up for continuing education credits on the supplement side. So for a myriad of reasons, and I'm not talking down to Advantage plans. I'm absolutely not. There's a plan for everybody, and it's important. I'm just going to focus on the supplemental side of the Medicare stuff, and everything else I come across, I'm going to give that off to people on my team.
Mm-hmm. Yeah. And because your strategy too is and I really want to talk about 2 things specifically with you, and that is your leads. So how you work your Medicare leads. Yeah. And then I'm going to share something around that too, some resources we have with Integrity. And then I want to talk about the referrals because I think whether people are watching this and they want to sell Medicare or final expense or annuities or IULs, whatever it is that tickles their fancy, right? The key to becoming, to switch from becoming, I don't want to say a peddler, but a transactional salesperson into becoming an agent with clientele. The key to that is referrals, right?
Absolutely.
So let's talk about leads first, because I know a lot of people will watch this podcast and they're like, okay, yeah, I'm curious about Medicare. Maybe I'm even contracted to get my appointments. Maybe I have some appointments and some writing numbers. Now, how do I use these things? How do I get in front of people?
Right.
And we have some standard things like, hey, use your book of business, and
Yes.
your agency owner probably has thousands of leads of orphan clients that the agents aren't here anymore. But if I was just starting from, didn't have any of that and wanted to get leads, you like to use T65 leads, right? So can you tell people what those are?
Yeah. So a T65 lead, basically when you're within 6 months of turning 65, as I understand it, as when you're within 6 months of turning 65, there's a mailer that goes out, right? And people fill it out. And I've always loved those leads. I know, call me Blockbuster versus Netflix and all this other stuff. Hey man, I'm still rocking it, right? I'm still hitting my numbers. Maybe I'm Blockbuster, but I'm still I'm doing just fine.
Not out of business yet.
No, I'm doing just fine. Just make sure to rewind your VHS tape.
That's right. You can rewind.
Yeah. Right. So I love those mailers, because when I've got them on the phone, I'm booking the appointment. It's like, no, that's not me. It's like, well, Eric, yeah, it is. Do you put a line through your sevens? It's like, yeah. And did you maybe have a pink glitter pen when you filled this out? It's like, oh my goodness. Yeah, that's me. Right. So it's really hard to dispute that I actually have your request in my hand. And so there's high intent, and they're inexpensive. I think they're somewhere like around $30 a pop. I mean, so they're not really costly. There's high intent. It leads to just a huge expansion of my book of business. And, when people are losing their benefits, they're retiring, and they're feeling that everything's shifting, right? They're losing their life insurance. They're losing their health care. They're losing their routine. They're looking for somebody to be a bridge into what this new wild unknown thing is going to be. What does it be to be retired? When you jump into that part of their life, and it's like, so within 6 months, you're going to be 65, you're going to be going on to Medicare, you're going to be dropping your other plan. And then I say, we're going to go ahead and submit this application today. If approved, they will pull one premium, but that's your first month's premium when you actually go into Medicare, because they're not going to process your application unless they pull a premium. That makes sense, right? They have expenses in their back office, but it's not that you're paying for the next 5 months, even though you're still on your company's healthcare plan. It just kind of punches your ticket. So you've already paid for the 6 months down the line. And so that is just, it's gold, Eric. I'm telling you, it's gold when you sit there and you can put somebody at ease. And the financial inventory is the financial inventory. I don't care if it's mortgage protection, final expense, Medicare, it doesn't matter, because when it comes to writing a supplement, it's not cheap. Last year it was $148. This year it's $170. Everything went up just astronomically. And so you're looking for somebody that's really not balking at the number, right? And if they're not balking at the number, because I have nothing to do with the 170. That's just the government saying, if you want to be on, Medicare, it's going to cost you this.
That's your Part B premium is what you're talking about. Right.
Yeah. That's just to have Medicare. That's not to use it. That's just so that you have access to it, right? And then when you start using it, you're either going to know your expense or you're not. And that's the way I put it. It's like, well, an Advantage plan. So there's parts and plans, right? So part A, B, C, D. A is the hospital. And so when I explain Medicare, I just take a blank piece of paper and I say part A, and then I draw a little square and I put dots on it. And I say, so that's the hospital, right? That's part A. And that's free. As long as you've had 40 quarters of work, that's 10 years of employment, paying your federal taxes and whatever. So you qualify to be on Part A. It's free, beds, blankets, Jello, and then, but the deductible, that's on you, the $1,556 per event. So what's an event? Well, it's both why and when. So it's like, let's say, Eric, you stroke out, not dead. You go to the hospital, that's an event, right? And so that's $1,556. That's not cheap. right?
Right.
And so, after 4 days, you actually are doing pretty well, and they send you home, and they like to put you in the wheelchair, and customer service, and bam, they hit a pothole, and you fall and you break your arm. Like, oh crap. So they got to take you back in. Well, that's not the stroke.
That's another event.
That's another event.
Yeah.
So, I mean, if you went back for the stroke within 60 days, it's the same event. After 60 days, it's not the same event. If it's not the same thing, it's not the same event. So those deductibles, that 1556, that can add up pretty darn quick. The supplement covers that, right? 100%. The supplement covers that 100%. And then in the Part B, that's the doctor, right? So, you're in the hospital, you're going to see a doctor. Medicare will pay 80%. You're on the hook for 20. I actually had a client that had stomach cancer. He was on a supplement, and it was $100,000 operation. His cost was zero. Okay. So do you think those guys like me? I wrote 8 policies in their house. I moved their retirement.
Wow.
Yeah. I put 2 supplements in that house, 2 final expense, 2 drug plans, and 2 retirement accounts. And that was like 3 years ago. These people love me, and they tell all of their friends, you got to talk to this Brad guy, right? Because I'm full service.
Because you provided full service. I was just going to say, you covered the whole thing.
Everything. Right. So when they have a question, they don't even have to think about it. They just text me, and then I jump on the phone with them. And it's usually a really simple thing. It's like, how come the drug plan costs went up? It's like, yeah, everything goes up. I'm sorry.
Right.
I have nothing to do with that.
But it's crazy too, because I know so many agents, we're more price sensitive sometimes than the customers are. It's like, oh,
Right.
this is like $12 more, and I don't know what to do. And it's like, look, just when you're providing real value, I mean, that they're spending more premium probably than most of your clients do, right? Like that's probably
for sure.
sale, but they don't feel like they're spending money, like they're getting value out of that, insane value enough that they want to tell all their friends about you.
Right. So I say, you've got the hospital Part A, that's free as long as you've worked for, 10 years, 40, 10, 40 quarters.
Yeah.
Yeah. Thank you. And then B is the doctor. And then C, that's, you're on somebody's version of Medicare, right? You have to have A and B. But then if you're on the Medicare Advantage plan, then you're in a network. You go where they tell you to, and you see the people they tell you to. You have to stay in network unless it's some kind of an emergency. I mean, if you're having a stroke, don't drive past a bunch of emergency rooms to find your network, right? Just go in, get healthy. And if you don't sign up, and this is the hook, if you don't sign up for Part B and you have no credible care through your employer, it can't be that you bought your own plan outside your employer. If you've lost credible care, health care through your employer, and you're 65, you got a 7-month window. You miss that window, they're taking away 10% of your Social Security benefits forever. And when people hear that, most of them already know. I mean, they get some literature, and their friends tell them, oh my goodness, don't miss your window. 3 months before your birthday month, 3 months after your birthday month. Well, I see them 6 months before that happens. And I reinforce those things. And they're like, well, I'm on my way to a seminar to learn all about it. It's like, oh, excuse me, ma'am, but you're in a seminar right now. Right. Yeah. Those guys would be coming to me, right? I'm the guy that would be at the front of that room, and I'm in your living room, right? So we're good, right? So I let them know that, Part B, you have to sign up. Well, you can do whatever you want. I mean, if you want to lose 10% of your Social Security forever, that's on you. But then so there's A, B, C, and then D. If you don't sign up for a drug plan, it's like, well, I don't take any drugs. It's like, well, I don't make the rules. It doesn't matter until you're on a drug plan. They're going to subtract 1% of your Social Security benefits month over month until they see you're on one. So that's not as bad as 10, but I mean, 11%, let's say that you're, making $2,000 a month on Social Security benefits. And, do you want to lose $220? Why would
month?
You? Yeah. Right. I mean, that's going to
worse than the premium.
Right. That's going to cover your supplement 100%. Right. So I just tell them it comes down to this. Either you're going to know your healthcare costs or you're not. It's kind of like with the Advantage plan, it's all in there. You have medical, dental, vision, drugs. It's like the buffet. You may not like everything on the buffet, but it's all there.
Well, it's interesting too, I think, for people that for people like me, I'm in my late 40s, and I have a health plan, right? I have I think it's Blue Cross or something.
Yeah.
In fact, I'm pretty sure it is Blue Cross.
Okay.
That shows you how much I use my health.
Right.
But my wife uses it all the time, so we get our money's worth. Anyway,
Yep.
so but with Blue Cross, right, I have a network of doctors I can go to.
Yeah.
Then there's the out of network coverage that I pay more for, right? There's
Right.
certain benefits that are included. There's certain benefits that aren't, like acupuncture, we have to pay full price, right?
Sure.
But
Sure.
okay. So when you go to Medicare Advantage, it's basically the same thing. You're going to go
Yeah.
on Aetna's version, Humana's version, whatever
Right.
it is,
You bet.
and it's going to have things you can do, things you can't do, doctors
Yes.
in network, out of network, whatever.
Mhm.
The difference between that and Medicare, and I think this is what is challenging for people to get that haven't experienced it. But
Right.
when you're on Medicare with a supplement,
Yes.
there are no networks. Like every every doctor can choose if they want to be a part of Medicare or not, but I don't know
Right.
what the statistics. I think 99, 98%
Oh, yeah.
of all doctors are in it. It's the fact that they all take it because it pays the fastest, right? So,
Right.
and you can walk in anywhere. You don't need a referral.
Right.
You don't need anything. And depending on the type of supplement you have,
Right.
I think Plan F that's the Cadillac. Like you pay nothing, except that
Right.
you can't get it anymore unless you were eligible before 2020, right?
Yeah, you had to have been born, like you had to have turned 65 a couple of years back, right?
Right.
Yeah.
So if you're talking to somebody who's, in that 68, 69 or plus, then you're good. But the next best thing is G, which
Correct.
Plan G is basically, it covers everything except you have a one-time per year deductible of like what, $250 or something, right?
I just looked it up being prepared for you, and it's 233. Last year it was 205. So everything went up considerably, but yeah, you're right. G and F are the same except for the one-time annual Part B deductible, and that's 233 this year.
233. So like, I was asking a friend of mine who's he's in his late 50s, and he's like, yeah, help me understand this. I said, well, if I told you that for a couple $100,
right,
you could literally have zero healthcare out-of-pocket costs, except for
you live in the hospital, it'd be cheaper than a hotel.
Yeah. Right. And yeah, he goes, well, yeah. I mean, so anybody with a few extra nickels rubbing together typically is going to want to stay on full Medicare.
Right.
And then the people that may be more, let's say, price conscious, they may be more motivated to do a Medicare Advantage. Is that fair?
Yeah. So let me talk about that for a second, because everybody likes free, and that I put it this way. So how much have you heard on TV about the supplement? It's like zero. It's like, why do you think that is? I mean, everything happens for a reason. Typically, money, right? Why do you think that is? Why would they be whoever they are? Why would they be pushing an Advantage plan? I can tell you why.
Because it saves them some money.
I can tell you why. Because the more of the cost is on the burden of the consumer. And so here's the thing. You don't know what you're going to pay until you do. You're going to have co-pays, co-insurance. It's like stroke. Okay, let me open my book. Stroke. Oh, page 99. Boom, maximum out of pocket. What's maximum out of pocket? Oh, they didn't talk about that on TV. Well, actually, it's little teeny words at the bottom of the screen. You may hit a major illness that you're going to hit the maximum out of pocket, MOOP. So what's MOOP? Well, it's about 3 years of premiums for a supplement, right? So it's like, well, it's free for the Advantage until you use it. Okay. And then depending on what it is, if it's a major medical issue, you'll be thankful you're like the guy with the stomach cancer that had the $100K surgery. His cost was zero. He would have hit MOOP. And in Washington State, where I just moved from last year, MOOP was $6,500
a year.
Right. So it's like, well, you could pay me now or you could pay me later. So either they're going to tell you where to go. And it's like, well, so if you're on a supplement, you go wherever you want, even internationally. Okay. There's no network. There's no co-insurance, right? But there's also no dental or vision or drug plan. It's kind of like
so you have to have a supplement for that too,
right? So I say you can go to the buffet and get the what is it, the cube steak, because that's what they're serving today, right? with the broccoli and all that. It's kind of a little bit tainted. And then there's the supplement where it's like, well, I'm going to do the New York today because that's what I like. That's, I've always had the New York. I'm going to stick with the New York. It's like, there's no wrong answer here, but don't be confused. There's nothing for free. And so it's like, one, you're taking your chances and maybe it's a budget thing. Or maybe you're just a risk taker. I'm all in, number 11 black, just let it ride.
Yep.
But if you want to know what your costs are, and they're going to go up year over year, but you can go wherever you want, your cost. It's like no surprises. I would,
Yep.
and I say these things and I say you can choose whatever, right? But I'm going to focus on supplement. And if it was me, if I was 65, by the way, Eric, I'm not.
That's right. That's right.
No,
we should put that in the caption here. Brad is not.
So 65. I am 59 and
okay.
Like a lot. I'll be 60 in 2 weeks. So, but I'm not
Happy birthday in advance.
Thank you. I'm not on Medicare. So, but if I was to go on Medicare, I would absolutely do a supplement 100% because I don't want some big moop in my future.
Right.
Yeah.
Right. So when you, I love it. It's super educational, I think, for people. I think that was really, really good. When you're, let's talk about, well, first of all, too, I was going to say about these leads, because we started talking about T65 leads. Are there any other kind of leads around Medicare that you like or that you've used?
Yeah, no. So, but I have, I haven't found any others that do as good a job as those T65 mailers. They've just been money for me. And I don't, if it's not broken, don't fix it. But it's not the only way that I've found Medicare clients. So I have a book of business. I go back through it. It could be just an internet lead where they're looking for final expense, but they're within 6 months of turning 65. It's just what you're paying attention to. You should be paying attention to everything. So when I sit down with somebody and I show them my business card, it's like, this is what I do is on the front and who I do it with is on the back. I only deal with A-rated carriers. They're Moody's, Fitch, Standard & Poor's, AM Best. They're all old and rich. They will outlive us. That's the idea, right? And so they're good quality companies. But on the front, it's like, I do it all. I do health and wealth. And so when I'm sitting there for final expense or mortgage protection, they're like, the annual enrollment period's coming up and I'm really not happy with this other plan or my agent or whatever. Can you take care of me there? I'm always listening for whatever opportunity I have when I'm sitting in front of a prospect to broaden the value that I'm bringing them, because that's going to lead to sticky business. My persistency has stayed in the 90s for quite a while. Right. So I write a lot of business, but my business doesn't fly off the books. And I get a lot of referrals as a result because I'm looking at more holistically. I
think that what you just said about having an antenna up, sometimes, when I first got in the business, I mean, I sold cancer insurance. Right. So that's literally we had cancer and heart and accident policies that would pay you cash if you went through one of those things. Yeah. And that's all we had. And so when I would hear people say, oh, they would even literally ask, do you sell life insurance? Do you have health insurance? No, I was captive, right? No, we don't do that.
Sure.
And so everything I was listening for was a cancer story or a heart story or something that I could capitalize on. Right. And because, that was it. That's all I had. Right. And I think for us as family first agents, by adding these things into your toolbox.
Absolutely.
You begin to have that antenna up to listen for anything, right? How can I just be of service?
Absolutely. It's like, my father passed away and the house is coming to me, boom, annuity opportunity. So when that money moves, what are your ideas to make sure to protect and grow that? Because I do that. And in 2 years, when you turn 65, I got you. I'll be swinging back by for your, your enrollment period to go in. You only turn 65 once, right?
Right.
So, yes, it's a little bit of education you need to get, but it just pays. It pays off in so many ways when you're well-rounded and there's really no opportunity that can come across your purview that you can't help somebody with, health or wealth, right? I'm full service. I got you from womb to tomb. Right. Yeah. From 2 weeks age all the way up to 89. I got you. Right. And I don't care if you're running a marathon or breathing through a tube, smoking a cigar. I got you. Right. When they see that you actually care and you can provide the service for both their parents, their kids, their siblings, just a 360 view. It's like, I don't know, call Brad. There's so many times I hear people say that. I have no idea. Call Brad.
Call Brad.
Yep.
So so let's talk about referrals for a minute. So with referrals, is there something special that you do or say? Because it sounds like the way that you're having your conversations is almost a natural thing that happens at the end, right? But is
Yeah.
there something you say up front to kind of prep them for that? Like, how do you,
Yeah.
tell us how you think about referrals?
So I kind of plant seeds from the moment I walk in the door, and I'm looking for opportunities for ways I can help that family, and obviously in return help my family, right? By putting, more than one policy in a house, it raises your persistency. Obviously, these things are not free, so there's commissions, and I don't really focus as much on the annualized premium as much as the number of policies that are being placed that stay on the books, because premium is going to work itself out one way or another. It's like, oh, well, Medicare doesn't pay. You only get like $200 for like a switching, or 500, whatever. I don't even care. It's like, it puts me in front of a lot of people. And the more people I'm sitting in front of, the more people that I'm going to be able to protect. And so as I'm listening to the things, so it's not just about talking, it's really more about listening. And so it's like, well, hey, Betty, what do you do in your free time? I mean, what are you going to do in retirement? I don't even have a plan. I mean, I love what I do. I hope it shows. She's like, oh, no, I can tell you definitely love what you do. It's like, yeah, I'll do this until I stop loving what I'm doing. I hope that makes it all the way to retirement, but I have no plan. What's your plan? And she's like, I play cards. I go to bingo. I'm very active in church. It's like, well, tell your friends. Oh, absolutely. I'm going to make sure as soon as you leave, you're such a nice young man, by the way. In the Del Webb community here, I'm still very attractive, right? Because they're like at least 5 years older than me, right?
Good surprise, Arizona. You are
right.
Yeah,
it's dynamite, dude. So, I mean, the referrals actually they come super easy, because when you go into retirement, you're looking for social events. You're looking for people to hang around with. Most people don't just ride solo and get in the RV. And I mean, some do, but a lot of people that go into retirement, they're looking for activities. And I just plant the seed. It's like, if you think that I did a good job for you today, Betty, would you please tell your friends? And she's like, absolutely. And I said, let me circle back in like a day or two, if that's okay, and give you a moment to think about your names. Because if you say, I'll have, Judy call you, I know that you have really good intent, but that typically doesn't work. If you let me know that you've talked to Judy and she's interested to see if I can help put her in a better spot, go ahead and send me her information and I will reach out, because this is what I do for a living. So it's kind of true with everything we do. Don't relinquish control of an opportunity, whether it's setting an appointment or running an appointment or following up on referrals. You want to, like, there's a string attached to that thing. You need to maintain control.
So you can pull it back.
Right. So you can pull it back. Otherwise, it's just kind of, you're throwing it out there and it's not coming back. Yeah. Then that works for me. So
one of the things that I was going to ask you, because I know you built a pretty big agency as well. You've got a lot of agents. So when you're, as you're talking, and I was just thinking about this myself, like, I wonder if people watching this go, man, like, how long did it take him to acquire all that knowledge? Because you sound really, and you come across really knowledgeable. What do you teach a new agent who's coming on board? What do you teach them first to get them up and running? And then when do you open the door for them to add on new knowledge, or do you just throw it all at them at once?
I don't, right? So, well, it's not one size fits all for sure. So I got this guy in Georgia. He's just a beast. It's like, so you call each number 10 times, right? It's like,
in a row. That's right.
Yes, you definitely do. What? So, I mean, but for the average person that's kind of typically like, lacking a little confidence, conviction, they don't necessarily know if this is going to work for them. They see it's working for a lot of other people. I kind of slow roll it, and it's really all about the phone. And it's about the phone, and it's getting in front of as many people to give yourself as many chances at bats, if you will, so that you can get those reps in, so you can get better at seeing more opportunities. So it's basically, depending on the leads in the area, I typically hire in areas where there are a lot of leads, and it's final expense. And then I don't let them stay on final expense very long, because I've seen people get kind of tunnel vision. Because if you're like, well, I'm just a final expense expert, I don't do annuity, I don't do Medicare, that mortgage protection with all those amortization schedules, that just sounds so weird. I'm just going to stay in my lane, and I'm going to write whole life policies, but I'm killing it. I'm doing 3 apps a week. It's like, no, that's a hobby. right? So you need to start somewhere so you can get paid, so you can get your lead budget up. But the sooner you can expand, the better you will be, because there's a lot of cross-selling opportunities to add even more value to what you bring the families you sit in front of. And by the way, the people that taught me, so Medicare, certainly Skylar Smith. I mean, that guy just kind of knows it inside and out. Yeah, help Mr. Wizard. And everything else was Matt Smith. And so how I learned, I just asked a lot of questions. I never missed training. I plugged in, and then I applied what I learned, and I made a lot of mistakes, and then I made it my own. And so, but when I'm in house, my structure is always the same. The Medicare appointments I ran 4 years ago will be the same ones I run today. It's the same stick man. It's like, I'm not an artist. It's just it's a circle with like little limbs coming out of it. That's the doctor. And the hospital is still a square with little dots on it. That's the hospital of beds, blankets, Jello, right? And I draw a little pill bottle for Part D. That's the drug plan. You got to be on one. But having that routine, that rhythm, and that consistency helps your confidence, helps your credibility. So if I'm going to let somebody take care of my healthcare supplement for me, I don't want to be the first client. It's like, oh, goody, I finally get somebody to help them with
to practice on.
Yep. Thank you. Right. So the reps really help, but you have to like start somewhere and expand out. And if you don't expand out, unfortunately, you end up kind of getting stuck. I've seen it again and again and again. People don't do all 5 things that we can do.
Because you mentally, and this happened to me unintentionally early in my career. I mean, well, actually intentionally, because I was working for a captive company. Right. Tip number 1, if you're watching this, don't be a captive agent. Okay, that's the best advice I can give you.
Yeah.
And if you are one, like, take what you've learned and move on. But it's true, because you start to think of yourself as, this is what I do, right? I am a final expense guy. I am an annuity guy, whatever it is, rather than, I'm going to be of service to this family in whatever way they need. Yep.
Yeah, exactly. So whenever I've talked about Medicare at like our annual conventions, that kind of thing, it's the most popular topic. And I have a sneaking suspicion it's because it's easy. It's really easy. You are the expert. Everybody needs it. Everybody turns 65. People typically don't want to have those gaps in there. And but there's the people that come up to you, they're solely focused on Medicare. I'm just going to do Medicare. And I'll tell them straight up, well, then you're going to go broke. I mean, if all you do is Medicare Advantage plans and you're cranking out like 2 or 3 a week, maybe, that is for me. Okay. So it's different for everybody. Right. But for me, that would not cover my agency expenses that I need to cover. I mean, it's just, it's a great, I'm not going to say loss leader. You definitely go to the appointment that you're there to run. And if that's where it stops, that's where it stops. Maybe there's referral, maybe it's not, maybe it's just a supplement, maybe it's just an advantage plan, and that's it, on to the next, right? But don't go in knowing that there's no other opportunity, because like I said, 2.5, can I say a number that's a real number?
Yeah, you can. Yeah, go for it.
2.5 million of my fixed indexed annuity sales in 2020 came directly from a T65 Lee Medicare appointment, and a whole ton of IULs, because with Forsters, you can be all the way up to 75. Right. And if you're 65 and you're healthy, and it's like, well, so I know you're retired and you've got this 401k. So we're going to roll that over. And then we're going to systematically withdraw from that to fund your smart UL with the increasing death benefit. And you're not even out of pocket. And if you have any questions about your health or your wealth, you know who to call. Call Brad. Brad. Yeah, man. So, I mean, I took care of their health care and I took care of their retirement plan. And I actually gave them some disability for major medical types of things, heart attack, stroke, cancer type of things. And they're generating cash and a death benefit. And it's all just like, I used to depend on my HR department. And now I've got Brad and the Emerald City team in his back office taking care of me. Man, I thank God you walked through my door. I hear that all the time. It's like, I don't know what I would do without you. Where do you even get all this stuff? It's like, well, you have to keep studying and be a student of your craft.
Yeah. Yeah. And I think one of the things you said earlier that really stuck out to me was, you went to these trainings and then you immediately applied what you'd learned.
Right.
And I think, I did a training recently with Sean Ruggiero.
Yeah.
And he said that one of the easiest things you could do is on your financial inventory that you're going to do anyway, right? You ask them that golden question, do you have anything that acts like life insurance?
Yeah.
And then when they say yes or no, whatever it is,
right.
I say, well, is it protected? Right. And if they don't know what that is, it's like, well, hey, well, then let's set an appointment for next week. I'll come back with some ideas for you.
Yeah.
Let me get some information. And you go to the Ask a Specialist page.
Right.
And you fill out a form where you can get the specialist to, and what he said, no, I just described all that. But the best way you can take action on that is to give yourself a challenge. Like, how many Ask a Specialist forms are you going to fill out next week?
Right. I love that.
And it makes a world of difference when you do that. So, like, same thing with if you're trying to get into Medicare, rather than, oh man, I wish I could get some Medicare clients. So, well, go do the business you're doing anyway.
Right.
And then at when you're doing the financial inventory, have you been, if you're 65 or later, have you been assigned your personal Medicare specialist yet? Have you taken whatever it is, that question, and then, okay, well, if you haven't, let's set an appointment, come back, talk about that later. And that's a way to fill up next week's schedule without you having to just a little less you have to do on dial day, to keep your schedule full.
Yeah.
So, right.
No, I've enjoyed running Medicare appointments right from the beginning, and I was always perplexed why more people didn't do it. It was, hey guys, I'm in the middle of a training right here right now, so that'd be great. So why more people don't go into the Medicare stuff, I don't understand that, because I think we don't train on it a lot. It's kind of like that. It's got this perception that you're just not going to, make much money at doing this, which I'm here right now. Anybody, you can believe me or you cannot believe me, but I was the #1 fixed index annuity producer in all of FFL in 2020, and half of them came from Medicare appointments. Fact. So I don't know if you know how much you get paid for writing an annuity, but it's the chunky money.
Substantial, yeah.
Right. And I have written plenty of final expense and universal policies as a result of Medicare appointments. So don't look down your nose at Medicare. That would be a huge mistake. I'm not
financial
saying
error.
It would be a major financial error. I'm not saying just do nothing but that unless that's your jam. That's not for me. I think that you need to use your entire license, and that's term, whole life, universal, fixed index annuities, Medicare, and then hire everybody and tell them everything and that's how you use your license.
I think my biggest takeaways from this conversation, Brad, is the first idea is just the idea of the value of every kitchen table. The fact that if I'm sitting here or on the phone with somebody, and if I'm trying to write a certain amount of premium, and say I'm trying to go Hall of Fame, right? That's a certain amount of premium, which breaks into a certain amount of policies. And if I'm thinking of myself as a mortgage protection agent, let's say, it's going to be a certain amount of families that I put mortgage protection in place with.
Right.
But if I think of myself as a full service agent,
right,
it could be far fewer families, because not only am I doing mortgage protection, but I'm also helping their grandmother with their Medicare, and I'm helping them with their annuity, and I'm helping them with and the guy that owns their business that they work for, who they play poker with once a week. Maybe I put a pension in place for him and a deferred compensation plan for him. And then, you know what I mean? And so if I'm doing all those things, now all of a sudden it goes from me having to protect, let's say 400 families a year to protecting 150 families a year. Right. But fully protecting them.
Exactly.
Yeah, I love that. And I think that's that's my biggest takeaway. And so I did want to share real quick as we're winding up here, just some next steps for everybody that's talking. And this is also probably good for your team too, Brad. Okay. So, family first, we already have, if you're contracted with us, you already probably contracted with America, you're probably already contracted with Mutual Omaha. You can get Medicare Supplement contracts through corporate for that. You don't need to do anything special. Just call corporate and they'll add it to your appointments. If you're contracted with Aetna for final expense, the Aetna CVS plan, you're contracted to sell Aetna's Medicare supplement, and it actually, you can add it into the shopping cart. As long as you have your health license, you're good to go. And then we have, through the Medicare team, if you go to fflmed.com, there's a red Get Contracted button at the top of the page, and you can fill out a contracting request, and we'll get you appointed with everybody else's Medicare supplement. So like, I mean, we have United, we have Humana, we have CSO, we have MAC, we have Medico, we have just everybody you can. I think we have 13 additional Medicare supplement carrier. Not that you need all of them, but what's great about it is that the mix that we selected with integrity after a lot of research to make sure that we have the most competitive plans in every region of the country. And it does matter, this plan might be the cheapest in your area or most price effective, but not in somebody else's area.
Exactly.
It varies by zip code. And so, depending on how wide you want your practice, that's why we picked the plans that we did.
You bet.
And so we putting our agents in a position that no matter what, if I sit down with a 67 or 69 or 73-year-old or whatever,
right,
that if they have Plan G and they want to keep Plan G, they may be able to save money by switching to one of our, from the carrier that they have to a carrier that we have.
Absolutely.
And just putting us in a position to win all over the place like that. So that's the first thing.
Yep.
The second thing is, if you like, Brad's training and you want some more training like this, we've built on the same website, a Medicare 101 boot camp that you can go through, and it's totally free. Just register there under the agent toolbox, and you can go through several modules. I think it's, I don't know how many I have, 15 or 20 in there, that just go through everything.
Yeah.
Original Medicare, Part A, Part B, Part C, Part D, how to sell it, how to position it, how to cross sell it. And in there, we also go through all the tools that we have that we didn't have before. So, but before we launched this, Mutual of Omaha, I think, is the second largest Medicare supplement provider in the country, in the United States.
Wow.
And so, in fact, I was just having dinner with the Mutual guys 2 nights ago.
Okay.
In Omaha, and we were talking about that. He's like, "Yeah, we used to be number 1, but now we're number 2." But I said, "Well, number 2, but you can try harder." Right? So that's like, but before, you would just go to their website and quote it and done. But now we have, because of all the carriers we have some quoting tools that literally you can go and once you have a writing number through one of the integrity. So basically, like for you, Brad, if you don't have access to these personally, you just need to get one contract on the new platform, and then you'll have access to all this stuff for free.
Nice.
So it's a full CSG actuarial platform. You go in, you put your zip code, you put the person's name and address, and male, female, and it pops up with every quote of every plan that we have.
Wow.
Incredible. And you can just, and same thing on the drug side. So, here's the doctor I go to most, here are the conditions that I have, the drugs that I take, and it'll tell them the exact Part D plan that they should be having.
Nice.
We have personal URLs. They're called PUR Pearls, which is basically you can get your own website where people can go, and you can direct them from your current website or put it on your business card, whatever. And if people go to that website, they can quote themselves and enroll themselves in a policy, and you get paid the full commission, even if you never even talk to them, which is incredible.
Wow.
And so it's just a lot. And we have all the T65 leads that Brad's talking about that are $30. Those are people that have responded to a mailing.
Yeah.
And we have free T65 leads that have not responded to a mailing, but they are turning 65. So they are getting mail from the federal government, every month, every week, probably about here's their upcoming Medicare thing. And so they're available for door knocks or stop bys or whatever in between appointments. Yeah. And that's free. And we also have a mailing list that you can download for free and do your own marketing too if you want to. So just a ton of great reases. And I'm
just fantastic.
Super happy about it.
Cool. You're doing a great job. How long have you been doing this?
I just, Sean told me I needed to start doing it in October. So we launched the platform back in early May. So May and June. So we got soft launch with a few teams, and now it's just open to the whole company.
So I think this is the integrity effect in full display, right? So I know that we've made a run at doing much more Medicare like focus in the past, but it was pre-integrity. This is just night and day. I mean, all the things you just rattled off, it's like, boy, if I had those available to me for the last 4 years, watch out, man.
Right.
I mean, it just sounds super cool, Eric. I'm so happy that you're leading the charge on this. It sounds really cool.
Thank you for being on here. I know it's been a long time coming. I wanted to have you on. So I appreciate you, appreciate your time. And everybody go to fflmed.com and we'll see you next week.
Thanks, Eric.